This song is a Hroth Eatliek, a song we use for dancing in and showing people our family. When we do these songs, we very often invite people to come, our guests, and dance with us. And we ask them to dance with us as though everyone were one, like a flock of birds. What the result is, in fact, is quite the opposite, and there's usually confusion and a lot of laughter because people become out of beat. The song is being used to illustrate the time in our history when there's been great confusion about health issues in our communities.
Hoo-ya, hoo-ya, yeah, hoo-ya, 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 yeah, hoo-ya, hoo-ya, yeah, yeah, hoo-ya, 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 yeah, hoo-ya, yeah.
Today, there are major gaps in the quality of health between First Nations and other British Columbians.
Well, one is to understand the predisposing factors that put the gaps in play. And so I've talked a little bit about the economic, the educational environment for First Nations. So that needs to be addressed. You know, barriers to economic self-development need to be removed. So that we need to address that basic predeterminants of health.
You know, it's our connection to the land that has been severed, and that's why a lot of our health is not there. Like a lot of communities were removed and relocated, as an example. And those are the communities that have the biggest issues with suicide, you know, the social issues, addictions, alcohol, because they were taken away from where their ancestors lived for thousands of years. And so I think more we understand that our connection is to the land and to the water, that it is that connection that has kept us healthy. And not only for ourselves to relearn and revisit and sort of reinvigorate that, is for the society as a whole to recognize it, that we do have that connection to the land.
Health to us is actually the result of having a sense of belonging, of knowing who you are, of knowing who your relatives were, of knowing what your place is in community. It's about social responsibility. It's about a whole complex network of relationships. So health is not the absence or presence of disease. It's a way of relating and looking and a way of being.
In many cases, health planning and service design is done at high government levels by departments that do not always agree and by people that are remote from the communities that are directly affected.
There's two kinds of services in this country. One that's run by the provinces and another one that's run by the federal government for our communities.
The federal government has primarily been responsible for First Nations health services on Brazil, and the province has been responsible for First Nations health services that require physicians, hospitalization, and others. And those have never talked to each other. Those two levels of government have worked almost in isolation of each other.
The province doesn't feel that they have to provide anything over and above what they provide at the community level in Fort St. James. And for Health Canada, they just say, oh, we don't provide that. So it's sort of like passing the buck. And I think that for us is the biggest problem we have is that no one seems to be really responsible for looking at what the actual needs and priorities in the community is.
BC as a unique place in Canada, we are one of the most transferred region in Canada, with about 75% of the communities actually managing their own healthcare services. So they hire their own nurses, their own NADAP workers, and all the other 20 programs that I've talked about, they deliver it.
They allow us to create community-based plans, but it's to activate resources within already agreed upon goals that they've set. So, you know, they'll set a target for us and then we have to react to that target. What we're hoping is that through this process we can put a plan together that really reflects the realities of First Nations communities, First Nations in their nation rebuilding activities, and have better outcomes with less use of resource.
The major partnership is now going to be First Nations and the regional health authorities and the people who deliver services, the professionals. I think that this will be able to focus the agenda, try and get better results in terms of the coordination of programs, and have a better holistic way of delivering services.
In this part of the world, we've had 150 years of colonial rule, where everything from birth to death were ruled by government legislation. And specifically with health, it's time we just took control of our own lives again. You know, the introduction of our own traditional medicines, our traditional healing practices, those things that were forced underground by legislation, to bring those back after 150 years of oppression. So that's what this is all about.